One more minute, and then you're going to give your little talk, John. Okay, John, let's go and do it. We'll see who else comes on. Do you want to go
Well,
ahead? Yeah,
yeah,
thanks.
welcome. This is your first time joining us. Your notes are all muted and remain muted throughout the meeting, except the co-chairs as we move through the agenda. If this is your first time joining us, your notes are all currently muted. Um, sorry. Following the presentations by the presenters as we go through the agenda, the co-chairs will call on members of the public wishing to speak. You can participate by pressing the raise hand feature below at the bottom, and not the wave or thumbs up feature, as those disappear. Only press the raise hand button once. If you press the hand will go down. If you're calling your phone, press *9 to raise your hand and *6 to unmute yourself. Be on the lookout for a prompt asking you to confirm unmuting once the co-chairs call on you. The chat is available to support only to help with Zoom software problems and not to ask questions of the co-chairs, as they will not see the chat. If you're using an older version of Zoom, you may need to find the React menu, Person menu, or a button that says More, where you will find the raise hand feature there. If you plan to speak during this meeting, it would help us if you could rename yourself to your first and last name for our records. Please do not raise your actual hand or wave at the screen, as we never will see you and chat with technical support.
Okay, thanks. Let me just ask a quick question, John. Can we do that, the capturing of the meeting, the audio, so that it will print out what everybody says?
Oh, yes, I can do
Okay,
that.
great. Thanks. Okay, I am Barbara Rudder. I'm co-chair of the Health Senior Social Services Committee. Wilma Johnson is my co-chair, and I hope she joins on at some point. Um, we have it's a big committee. It's a committee with a lot of different parts to it. And when we heard that Rebecca Seawright came and talked about the governor's state master plan on aging, our community is one of the largest growing senior communities. And I thought it would be interesting and necessary for us to learn what's there so we could advocate for what we need. Unfortunately, Rebecca couldn't come, but we're very pleased to have Dylan Klein, who's the legislative aide in Albany at this point. That I was told by Kevin that you're the expert on it, Dylan. Am I right? And I will say after that, we're going to hear from an agency that is been around for a long time and does wonderful things, DeRote, and what impact they will have on our senior community. But first, Dylan, thank you for coming. If you would introduce and talk about the 9 pillars of this talk, and then we'll have questions after for you, and then we would hear from DeRote also. Thank you, Dylan.
Well, thank you. Thank you so much for that very kind introduction. Expert is very flattering. But thank you and good evening to Community Board 8, Health Seniors and Social Services Committee. As Co-Chair Rudder mentioned, my name is Dylan Klein. I'm the legislative aide for Assemblymember Rebecca Seawright. I would like to thank you all, especially the co-chairs Johnson and Rudder, for extending this invitation to our office to discuss the important New York State Master Plan for Aging. Now, the New York State Master Plan for Aging is a policy guide and roadmap that reflects New York's commitment under the leadership of Governor Kathy Hochul and with massive collaboration from hundreds of governmental organizations, nonprofit service providers, local facilities, and advocates that really advocate more for the 4.8 million New Yorkers that are 60 and over. Now, the MPA contains, as you mentioned, 9 pillars of core support areas. In those 9 pillars are 126 individual proposals. I won't get into all 126 proposals, but the 9 pillars of the core support areas are caregiving, workforce, and community-based services, financial sustainability of services and providers, prevention, housing, affordability of basic needs, servicing historically underserved communities, social engagement, combating elder abuse, ageism, ableism, and stigma, and technology. And including in the MPA is a legislative roadmap for the legislature for when the assembly reconvenes in January. The MPA calls for a $35 million investment to reduce waiting lists, expand health and wellness services, and increase social model adult day services, $43 million for sustainable nutrition support, 20 million in aging services network workforce programs, and a $10 million increase for the funding of the long-term care ombudsman program, and just so much more in funding and legislative changes. And one important line that is really some of the most covers some of the most talked about topics is the unavoidability of caregiving for New Yorkers, and it's acknowledgement of the reality that all of us are aging, including myself, and we are all one day going to reach the point where we can't move the same as we did when we were younger or do the same activities without assistance. Trust me, I'm feeling the same way sometimes. And
Many
this
of us have
acknowledge
gotten to that point, Dylan.
But this acknowledgement, though, in the MPA is a huge step towards the destigmatization of aging, caregiving, and needing care. It's also an acknowledgement of the costs of caregiving. There's undoubtedly a caregiver crisis in New York, and that's something that we have been working hard to combat in the assembly. And the assembly member, especially in budget talks, is going to be hammering this issue because family caregivers are spending on average nearly 20% of their income on caregiving activities. And especially in a cost of living crisis that we are in now, we need to find ways to take that off the backs of New Yorkers. So full implementation of the MPA would provide a huge relief to many of those struggling families who have earned a right to a comfortable and affordable life in our city and state, especially those who have worked and given so much to the state for decades within our workforce. So the assembly member thanks the governor for her strong commitment to our older New Yorkers. And as chair of the aging committee, and especially as the assembly member with the largest concentration of older adults in New York, in Manhattan, the assembly member is eager to roll up her sleeves and get to work on supporting the implementation of the MPA. So I'm happy to take a couple of questions on the master plan for aging. I know that there are plenty of topics within it. I was a little broad in that introduction, but if you have a little
Can you go
specific
into a
areas.
little bit more of maybe what each one does? Caregiving, I know, of course, is a big one, and I do have a lot of questions about that.
Mhm.
But even what would workforce be? The people that are still working, or what does that mean?
So yeah, so there are older New Yorkers who go back into work through either community service programs, volunteer programs, providing ways to enhance those programs is certainly within the master plan for aging. Furthermore, uh, it also is about partnering with strengthening the workforce for caregiving. We have a need of more caregivers in the state, and there is a large wage gap as well within those caregivers. So that is addressed within that pillar as well.
And the elder abuse, by the way, I don't see transportation as being part. And Elizabeth, I'm going to give you a chance to talk about it. But mobility is a problem. back and forth. Is there a talk about how to make it more mobile and make things easier? And I know Elizabeth Ashby has a specific question with it. Transportation is not one of the pillars, or is it in part of something else that I'm missing?
Hello?
Yeah, do you hear me?
Sorry,
Am I not, am I am,
I think
I might
yeah, do you hear me?
it keeps cutting in and out. I'm sorry.
good. All good.
Am I cutting out with you, John, too, or is it
No,
me?
it tells in his
It
end.
it it might be on my end. I'm sorry.
Okay, I'm going to make it a little louder. Um, Transportation is something that Elizabeth Ashby is going to ask you questions about it, but mobility is a tremendous problem of and getting around the city. Is that in one of these pillars? It isn't a specific pillar, but it is it one of the pillars. Do,
So
do
it
you hear me now?
so yes, yes. So
Okay.
it is within the pillars. So it's actually proposal number 48. It would establish a $2 billion fund for grants to municipalities to make infrastructure and capital investments, including in transportation systems. So that is something that the city would be able to tap into.
Right. I will say there was a horrible accident recently that an 89-year-old man had killed an elderly woman. He must have had some sort of stroke or something. He was driving um, along the way. And, as you get older, it makes it harder. Um, some of the other technology, is that sort of um, making sure our buildings are more Wi-Fi. What would technology, teaching technology, what would that be?
So uh, that covers multiple topics. It's data for provider systems, access to technology, as you mentioned, such as hardware, software, internet connection. I mean, it's hard to believe that in 2025, but there are places in New York that it's very hard to get Wi-Fi and internet services. So this being a part of the proposal, I believe it's number 76 uh, under technology. That is something that is covered.
Um, when you talk about elder abuse and all of that, isn't that up to the DA to do it? What is it that this will do? And wouldn't that be community by community rather than statewide?
So yes and no. Of course, there's a partnership to be had with DAs, local law enforcement, and those areas, but it's also about public awareness on the types of financial scams and frauds that are out there. I mean, I'm sure you guys get the same texts that I do about your Easy Pass is overdue, or the new one being your inflation refund check is in the mail, but we need you to confirm this and that. Those are all very common scams that people are giving hundreds of thousands of dollars just about every single day to. So it's about that. It's guardianship, scam recovery, and
Guardianship isn't local. Guardianship is a state issue.
so uh, it so it falls under Article 81. Article 81, there would be a establishment and funding of an Article 81 guardianship program to oversee the Article 81 guardianship services. And that would also establish a committee within the unified court system that would look at the availability of guardianship alternatives, providing education, planning, supports tailored to individual specific needs. So yes, it is a statewide issue with local help.
Okay, I'm going through all of them and then everybody else will ask. And I do have more questions than I'm even asking. Housing. Our community board has spent a lot of time, and the city has the city of yes talking about affordable housing, whatever the word affordable needs means, and so on. Um, what is what specifically is in here?
So, and I think this is something that everyone's been hearing for the past year now, housing supply. Addressing the housing supply is somewhere that we need to start at. Adaptive reuse of existing buildings, ADUs, zoning ordinance revisions, housing models for seniors. These these are topics that cover addressing the housing supply. There's also about strengthening modification programs for home for people who are in need of a stair lift, stuff like that. There's also about aging in place. That's also a critical portion of it. So I believe that you would also say that that funding of 2 billion could also fall into that municipalities could tap into. But of course, addressing zoning, ADUs, and the housing supply is certainly one of the key
What's
pillars under
ADU?
housing.
Tell me what ADU mean. Affordable.
Uh, no, accessory dwelling, excuse me, sorry, accessory dwelling units. It's a mouthful.
Which means, what does that mean? I don't.
So, I'm trying to best describe it. It's basically a second in it's a second space in an apartment or a house. So it's basically a convert of a single family house to a dual resident
I see.
housing.
Okay.
Yep.
I'm going to open up if anybody, and I know anybody has questions. And Elizabeth, do you see any questions, John?
Yes, Dane, I see his
Oh,
hand.
wonderful, Dane. Great, thanks.
Hello, can you hear me?
Hi, Dane.
Hi.
Hi, Barbara. Thanks for hosting tonight. Dylan, thank you so much for joining us and providing an overview of the Master of Aging Plan. It's really helpful. I do think that it would be really important in this presentation tonight for you to address how the Medicaid cuts are going to impact the
Right.
Master of Aging Plan, because we know that there are going to be significant cuts coming over the next few years. And in addition to that, a lot of long-term care and senior health funding is intertwined with the Medicaid population. So I just am wondering, like, one, what is Assemblymember Seawright doing to try to combat these cuts? And then two, um, what are they like? What are you discussing internally on how these cuts will impact this plan? Because I hear you throwing out all these numbers and they sound great, but these cuts are massive.
Right.
And I don't think people understand the scale of the cuts. And I fear that a lot of these things, for example, you spoke about caregivers, right? The consumer CDPAP, the program CDPAP.
Yes.
Um, Sorry, I lost my train of thought. Yeah, CDPAP, like how would CDPAP be impacted, for example? So things like that. If you could just speak to that, it would be helpful.
Can I just add one other thing? With what's happening with immigrants, what effect will that have on caregivers and so on? Do you agree, Dane? That,
Oh,
I do agree, yes.
okay.
Okay, so I'll try and break it down into because that's a couple questions in one, but it's a completely valid set of questions. So the disastrous cuts that are coming out of Washington, we're watching just about every single day what is happening, and we are we're trying to figure out numerous ways to produce funding. Now, we are in a situation that we have a healthy state reserve. We have a healthy state bond rating. So we're in a good financial situation. When it comes to Medicaid, we are still trying to fully understand the impact of the whatever big beautiful bill, disastrous beautiful bill, whatever we want to call it. What we do know is there are new limits on non-citizen eligibility for Medicare. There is no change for permanent residents, certain, I believe, immigrants from Cuba or Haiti, and immigrants that fall under the Compact of Free Association States. That we do know. We are looking at what other impacts there will be to caregivers and to CDPAP. When it comes to federal funding, that is something that we are working with our federal partners in Representative Nadler's office and the entire state delegation as well, and advocating for them to vote to not cut Medicaid, to not kick people off of insurance, because we have a large amount of people that will end up losing coverage because of the disastrous choices made in the OBBA. So we are looking at funding streams. This is something that will be discussed more when they come back to session in January. I, of course, am not fully a part of those conversations as I'm not the member, but I am trying to see what other ways we can navigate this situation and find unique ways to continue funding these programs and provide more funding to these programs.
Thank you.
Mhm.
Dane, that was okay. Any other questions?
Yes. Outside of the funding cuts, I was hoping, because obviously, part of we call it the big ugly bill at work, because there's nothing beautiful about it. Let's just be honest. Um, could you speak to how um the new requirements for work requirements and reassessment of Medicaid eligibility will impact or impede seniors from accessing these services in the master plan for the aging?
So, how the new work requirements will impact seniors who receive Medicare.
Yeah,
So,
so those seniors they're either on Medicaid or they're dual eligible, meaning they are on Medicare and Medicaid. There are a ton of new requirements that are going to roll out in the next couple of years where you have to demonstrate that you work X amount of hours a month. And then they also have to reassess you for Medicaid eligibility, meaning you make a certain amount. And it's obviously up to the state's discretion on how they want to roll out these reassessments and work requirement checks. But I'm just wondering if the assembly member is already thinking about how this is going to impact people being able to just stay in the program. So that's going to create a lot of administrative barriers.
yes. So, I do believe, if I remember correctly, the change for the work requirements does not go into effect until 2027. However, that does not mean that it is not something to worry about. Now, that is something that we will likely have to explore legislatively in Albany come January. Um, Granted, this is a federal issue, and usually federal law does override state law and the regulations for the program. Um, I would reach out to Representative Nadler and see what they are working on to combat that specifically on their level, because that is more so their territory. But I can tell you that we are fully opposed to these work requirements and are open to just about any single way that we can keep our seniors on Medicare and Medicaid.
There's a lot of unknowns.
Unfortunately, and that is the unfortunate reality of the political times that we are living in.
Thank you. Dane, is anything else so far? Okay,
That's it. Thank you so much, Dylan.
thank you. Anybody else?
I see Elizabeth has her hand up.
Okay.
Thank you very much. Yes, what I've talked to Barbara
Right.
about, because not only is it a huge problem for those of us who are on a rollator, it's a problem for practically everybody who talks to me, is how high above the ground the entrance to a taxi and or a hire car are. There ought to be some accommodation that can be carried in the taxi, or a, a perhaps a couple of steps that are lower uh, than the huge step, and then a huge uh, uh, high seat uh, that even people who get around perfectly well don't need any help whatsoever have complained that it is extremely difficult. And um, because it's so difficult, people who are young and healthy and can get in, say by the time they've got in, the door's closed on them or something or other. So I really think that um, some gizmo should be invented that makes it possible for people without a great deal of help. And by a great deal, I mean two or three other people pushing you and helping you. So I think that this is a problem for the elderly, it is a problem for the handicapped, and it's a problem for practically anybody who isn't an Olympic athlete. So I hope that whoever is in charge of that can invent a simple thing that would solve the problem.
So I just want to clarify, are you talking about on buses?
No, it's
No,
the taxis,
taxis
New
and
York City tax.
hire cars and limousines, and then, anything that you have to get into to get somewhere. A taxi, hire a car,
Mhm.
Uber, or whatever,
Mhm.
and forget about asking for a lower one. There's no such thing.
Mhm.
So
Yeah,
um, uh, it's non-public. Of course, you can't get in the subway and get in unless you have an elevator, which of course will be out of order. So uh, getting around for a good many people requires taking a taxi, hiring a car, calling a car service, that sort
Mhm.
of thing. And they all fall into this
right.
category.
Mhm.
I think
Yeah.
it's more of a New York City, problem than possibly in Albany. But I think that those taxis came about because I believe they can be used with wheelchairs. Am I right, Elizabeth? I think that the back goes
Well,
down.
wheelchairs are different because the people get pushed in the
I
back of
understand,
them.
but that's why they're high, I think. But it really is difficult to get
Yeah.
into them. And that's why I
But
brought
that
up
wouldn't make it
transportation.
necessary to be high, to put a wheelchair. Put a ramp down. The lower you put the ramp, the higher, the easier it is, I assume, to get a wheelchair up it. Doesn't have to be high for it.
Yeah, it is. It does make, that's why I brought up transportation. Mobility is extremely important. As you get older, you want to know, you want to leave the house and you want to get out and all of that. And it makes it very hard. I don't know if there's something that can be done. What do you think, Dylan?
So I would say this does sound more like a city issue. Although what I will say is I will take a look at this and see if there's something if this is something that falls in the state's purview. You certainly do make a good point about accessibility, and I do wonder if it's something that we could maybe look at how similar to how the MTA buses are, where they have a platform that can roll out
Yeah,
and whatnot. But let me look into this.
thank
Thank
you.
you.
Yes.
Is there any other questions, John?
No, I don't see any hands raised up. So,
I'm going to ask a few. First of all, right off the bat, yesterday we had a budget meeting with priorities for the budget, and I said I would ask today, out of these hundred or so individual sort of parts to these nine pillars, how much would it be state that would be funded, or are there things that the city should be doing and we as a community board should be asking the city to do certain things? Can you separate which ones?
That's a very good question.
I
So
promised I would ask that yesterday when I was at the budget meeting.
yes. So not everything within the master plan for aging has immediately a dollar sign attached to it. I did give a couple of bullet points on what the state through the MPA is proposing to invest and an increase. I can assure you, most funds would probably, in this scenario, come from the state, if not all, and be either given to non-service providers, localities such as the city of New York, um, and into the agencies themselves, the state agencies that run these programs. So it would likely be mostly state money. I'm not sure how much specific. I can't give you a number of how much it would be a share by localities. I do know that a lot of funds would be transferred to through most of these proposals would have to be transferred to the AAAs, the area agencies on aging, which in this case would be the New York City Department for the Aging. Um, and they would then be responsible for the funds that they receive to execute their programs.
And the community, the socialization, I'm going to wait to speak when DeRoad speaks. I know they're a wonderful organization that reaches out to it. Do you know DeRoad? Do you know him?
No, I do not.
We'll hear about it, whether it's New York City. Let me just also ask you about long-term care. Personally, I spend huge amount of money to have long-term care because the fear that of getting sick and not being able to afford it. I'm on Medicare and not Medicaid, and
Mhm.
to do it. What are you proposing for Medicaid for long-term care? Mostly for Medicaid patients, mostly in at home. What is it that would make it better than now? It's a horrible situation.
Certainly. So it's a mix. It's an expansion of adult care facilities and assisted living facilities, adult daycare access. As I mentioned earlier, an expansion of aging in place because that's where most people want to receive their services is in the comfort of their own home. They don't want to be moved to a nursing home. They don't want to be put into an assisted living facility because they want to age in the comfort of their own home. And that is something that's a large portion of the plan. There's also expansion for flexibility for long-term care facilities in terms of uh, allowing ACFs to add a list assisted living program beds. So we would be increasing the amount of opportunity to provide services to people. So that's also a critical part of it.
Mostly for Medicaid or for Medicare also? Would there be some help for Medicare?
So yeah,
For instance, there's hardly any home care that will come in. Medicaid is much better. I knew a case of a woman in her 80s who her husband had advanced Alzheimer's to a point where he was getting violent. She couldn't afford to put him
mhm.
in a facility, and she had like 2 hours or 3 hours a week of care.
Yes, and that's something that is covered in looking through the 1115 Medicaid waiver. for flexibility within that to expand into programs like that.
For Medicare or just Medicaid?
Medicare and Medicaid, yes.
Medicare also. Thank you. Any other questions? I mean, I could go through for every single one of these as in depth. What is the reality that they're going to be this, in any time? Uh, any idea of when some of these programs actually will be reality? And
So some of these programs are already reality. It's about expanding them and funding them and upholding them. Obviously, there's the programs that we need to establish. The reality falls within the in honesty with the pressure and the amount of advocacy. So we do need your help in supporting these initiatives. Of course, we're gonna come up in January and roll up our sleeves and fight to implement every single proposal and make sure it has every single dime that it needs to be successful. Because we have a duty to see this plan through. The governor has been dedicated to this since the day she signed that executive order in 2022, and we're gonna fight to reflect that commitment in the legislature.
so when you say that you could use our advocacy, do you want a resolution? Would that help?
That I whatever you guys feel would assist in that. Yeah, certainly. I mean, we are happy to always have your guys' support. I mean, both as a committee and as a community board, it's great to have these partnerships. So any collaboration on this would be great.
Thank you.
Yep.
John, am I right? It's just me, Dane, and Elizabeth from the community board?
That is correct, yes.
Okay. I'm going to call on Dane. Would you want to make some resolution? Are you unmuting, Dane?
Yep, sorry, I was waiting for John to hit the button, but yes, I would love to work on a resolution.
Okay, let's hear it.
What my resolution is?
Yeah.
I don't have one currently.
Okay,
I need to think about it.
On the spot.
These
Yeah.
9 pillars, maybe I'll work on it, but basically where these 9 pillars will enhance our, whereas we have a growing, one of the fastest growing aging communities in the Upper East Side, that these were 9 pillars that would address it, that there's funding being proposed on the state, and our resolution is that we aim, what do you think?
I think our resolution is that we aim to continue to strengthen access to care for seniors. And we also want to implement new alternative programs that can also strengthen access to care for seniors.
Should we mention the 9 pillars, just say that with the pillars?
Yeah,
So
within the 9 pillars.
that we support and hope for a quick implementation of the master plan, of the aging master plan. Does that sound good or too general or?
No, that sounds good.
Okay, and I may want to talk to you about it after.
Okay.
So I'll second that. Elizabeth, you vote yes, or would you vote no? Or Elizabeth is still on, right?
Yes, she
I
is.
can't see John. Are you? I assumed you're voting yes. Great. We'll do that. Thank you so much, Dylan. You were a great substitute for our wonderful assemblywoman. Couldn't
Thank you.
for some reason. And Kevin did say you were an expert on it. So
Thank you. And thank you so much for having me.
Kevin
And
Wu used to work for our community board. We know Kevin well. Kevin Wu was the assistant district manager, the community
oh,
board aide. Yeah,
that's wonderful. Yeah. Alrighty. Well, thank you.
we still have him. Thank you.
Thank you so much. Have a great night, folks.
You too. Bye-bye. We're next going to hear about DeRote, which is an organization I hear so much about and want to hear a lot more. Julia Kessler Holler, I think you pronounce your name, is going to present what DeRote does. All right. John? Hello? Can you hear me? John? Can you hear me? Oh, John?
Sorry, Barbara, I lost connection there and it
Oh, I
did
was
not let me
wondering
join
who
back.
was it?
It,
Okay,
it
great.
kicked me out for some reason. Sorry about that.
I don't know if anybody heard, but I introduced Julia from DeRoad. I don't know. Do I have to repeat? Julia Kessler. I, I forget the holler from DeRoad organization, which I has been around for a long time. Is Julia here and can do the presentation about DeRoad?
I am, yes. Thank you so much for
Thank you. I was getting nervous, like was it an
thank
issue?
you for taking me off of mute. I wasn't quite sure. Technology at its finest. So first and foremost, thank you so much for having DeRote here today. And I really am honored to be able to be the person who presents on behalf of DeRote. My name is Julia, and I am our Senior Program Officer of Supportive Services. And so that means not only do I have the privilege of working with a number of our social workers that are connected to a lot of our programs, but also working with a lot of the other program teams in a variety of ways that they connect with older adults. And I'm really excited to be able to talk to you more about that today. I am going to attempt to share my screen because I do have a PowerPoint.
Great.
Okay, I hope everyone can see my screen.
Yes.
Great, thank you. The challenge when I start with a PowerPoint is I won't be able to see you. So please feel free to, as best as you can, jump in if there is something that I am missing. So I really sort of wanted to start. I'm trying to figure out how to make this move at the same time. There we go. So really what I want to be able to start with is just talk a little bit about who DeRote is. As Co-Chair Rudder mentioned, we have been around for a long time. We are actually entering into our 50th year, which we are very excited about. And really the theme and goal behind so much of what we do is around how we can help build opportunities for social connection with older adults, as well as how we can also support them in aging in the space that they prefer. So whether that is in their home or moving to another place, we want to be sure that older adults are aware of any additional resources or supports that they might need. Just so you kind of have a sense, I'm going to start with a little bit more of kind of a macro, larger view, and then we'll get more into details, especially also around how constituents already in CB8 connect with DeRote. So DeRote is a nonprofit where our mission is to bring social connection to older adults. It is a built-in human need, as important as other what I like to call basic needs like food and shelter. Social connection is equally included in that list of necessary needs to continue living well in life. Significant research has shown that building relationships with others, even when they might just be casual, actually has a positive impact on our health, physical, cognitive, as well as also emotional. Dorot, as some of you might know, is actually a Hebrew word, and what it stands for is generations. And so while we are a Jewish organization that's founded on Jewish principles and values, we serve both the Jewish and wider communities, really by fostering just that, those intergenerational connections. We were founded in 1976, actually by a group of Columbia graduate students who were walking around their neighborhood and noticed that there were many older adults who were sitting on benches alone. And they decided that they wanted to see what they could do to help bring more connection into their lives. We have our main office on the Upper West Side in Manhattan, but we also actually do have a branch of what we do out in Westchester. And so to start, I just wanted to give you a slightly larger picture of just who engages in our programs. So last fiscal year, we supported over 6,600 older adults. And the way that we define older adults is 60 and above. And those older adults were involved in over 88,000 different activities that we hosted through Dorot. As you can see off to the right, we provide programs in a variety of different ways. So people will be able to access us via Zoom if they're more comfortable with that, having visits in their home, going to one of our Dorot offices, as well as also over the telephone. We are really very proud of all the programs that these older adults participated in. And I wanted to make sure to be able to share that these programs are all offered free to any older adult, really thanks to generous funding of both private foundations, as well as also state and city government grants and allocations. And it really, truly, all of those different committees and different groups who support us, including CB8, when connecting with us, we really wouldn't be able to do the work that we do if it was not for all of you. So we also, at Dorot, we sort of have two foundations really in the work that we do. And so one is really making sure that we connect the work that we do with older adults to social work principles. And the second is that really a lot of what we offer and a lot of how we offer what we do is based on volunteers who are committed to volunteering with us. This is one of the first organizations that I've worked with that truly has such a strong volunteer component in so many of our programs and helping make them happen. So as you could see, almost equally as impressive as the last slide, during our last fiscal year, we had over 8,200 volunteers who gave voluntarily over 49,000 hours of their time throughout the year, really to be able to connect to older adults, as well as also support Dorot. So as I mentioned briefly earlier, we do have in-home or what we call visiting programs, meaning that that's where we send a volunteer to the residence of older adults. We do this both in Manhattan and Westchester with different catchment areas, much of which CB8 falls within. So we do have on the east side, 14th Street to 96th Street. We focus more on the streets versus the avenues. I do have to add that unfortunately for in-home visiting programs, we are not able to currently offer those on Roosevelt Island, but we are able to offer those through a number of the other streets that are included. For those who live on Roosevelt Island, I will speak a little later. We have a vast array of Zoom over the phone programming, and someone certainly can come to us as well. But we wanted to start just a little bit with one of our signature programs that actually has participation already from residents within your district. This is a lovely picture of an actual friendly visiting match. This is Adam and Sharon. They have been meeting weekly for several years, just in a social visit. And so really the goal of this program is to be able to build new friendships in the comfort of an older adult's home. This can be a weekly visit or it can also be a monthly visit. Because the goal of this program really is to build a new friendship, we recognize that friendships don't often form quickly. So we have a 1 year commitment for this program, really to support having enough time to really meet and spend time together and talk and really be able to see that friendship grow. While that sort of from the get-go might sound a little long and a big commitment, many of our friendly visiting matches actually continue on for 3, 7, 13, even 15 years. And it's really something that's wonderful for us to see. In this friendly visiting program as well, each match is supported by one of our friendly visiting social workers. And that really is to be able to support both the older adult and the volunteer, not only in growing the friendship over that year, but also to be able to be present for any needs that might change. Because we certainly recognize that as time moves on, an individual's needs might change and they have a specific social worker that they can go to for that as well. In our district or in your current district for Community Board 8, I'm just going to do a little arranging so I can better see my screen. We actually currently already have 39 older adults that are in friendly visiting matches that are within Community Board 8 zip codes. And so we thought it might just be interesting to share a little bit about which zip codes those are, just so you can sort of see the variety of where people live. So for some, friendly visiting sounds like a big commitment, and a year might be a little intimidating. So we actually also offer other ways to kind of get your feet wet with an in-home visit for more one-time visiting opportunities. And that's what we call package delivery. And this is a program that we do 5 times a year where we have a volunteer and they will receive the name and address of a specific older adult who is interested in having a visit. And they bring this package, which is usually full of a variety of foods, to that older adult. And so the package is sort of what gets the person through the door. And then we encourage spending about 30 to 45 minutes of time together afterwards, just to sort of have some conversation and be able to at least get to know somebody a little better over a shorter period of time. Our volunteers who are involved in these deliver each time that we do this around 600 packages. That's inclusive for our Upper West Side as well as our Upper East Side. And we already have some residents in your neighborhood who are already involved in receiving some of our packages. We had actually 199 older adults last year, and throughout the year in total, they received 539 packages. One of our other in-home programs that we have is Response Team. And this is where we offer something that's a bit more of a practical support. And what that means is that there's a specific need that's more of a short-term need. So whether it's someone wanting to change over their summer closet to their winter closet, to organize photos, even getting together and playing cards, taking a walk around the neighborhood. This response team connection is not as ongoing as friendly visiting, but usually happens a range of 1 to 3 times, depending on what the request is. And this is also something that when we were looking into the data, we were excited to see that residents as well already are engaged in this too. We had 69 individual older adults who connected for a total of 225 visits by volunteers. Next, I wanted to talk about one of our very popular programs, which is our tech coaching. And so tech coaching is something that we are able to offer both on site at our Manhattan office, as well as also in the home of an older adult. And so how this program works is that volunteers will work with older adults to help them better understand the technology that they have. So whether that's learning how to send or categorize emails or delete emails, how to use Zoom, if you get the newest Android or iPhone and you would like some assistance in understanding all that it can do, we have volunteers who are able, again, either to come to your home or to meet with you on site for several sessions to really sort of have one-on-one coaching in terms of learning what your new technology is. This way, it's really able to offer really personalized and make sure that we're able to answer your specific questions. So this last year, we already had 47 older adults in your district who participated in 286 different tech coaching sessions. We also have visits by DeRote social workers. So for any older adult that is interested in having volunteers come visit them in their home, we start that process with a visit by a social worker. And we feel that this is an important first piece for older adults, as it helps a social worker come and be able to ask a series of questions around who you are, what your history is, what your interests are, any other questions or concerns that you might have, how you're managing both in and outside the home. We really do this based on our philosophy that when older adults, when you connect with DeRote, you connect as your full individual selves. And even if you're connecting because you're interested in one specific program, we want to be sure that we're aware of other areas of need or other interests or other questions that you might have so that we're able really to support you fully as your full person. Sometimes that can also include helping place warm referrals to different partner agencies. We are a wonderful organization, but we are not able to do everything for everyone. So we have a wonderful network of partner organizations that sometimes have specialties in ways that we do not. We also offer what we call lifelong learning opportunities. And so these, again, can also be on site or they could happen over Zoom. And these are classes around specific topics of conversation, workshops, something that can help promote health and wellness. We really have a vast array. As I was leaving the office today, one of our staff was getting ready to start a program where older adults were bringing specific memories with them on paper, and they were connecting with music students so that they could help turn those memories into a song in whatever way might feel well for them. So we're often very creative. We as well have exercise classes, concerts, art history lectures, and I could go on and on along the number of different programs that we offer. We as well, as you may remember that I mentioned in the beginning, we also have programs that are offered over phone. And so those two programs are University Without Walls, which is one of our longest running programs, as well as Caring Calls. And so University Without Walls is very similar to the ongoing learning programs that I just talked about. However, the way that you engage with the program is just over the phone. For some people, they're not as comfortable connecting over Zoom or don't have the technology or ability to. And so as long as somebody has a phone, home or cell, they can call into these programs and to be able to listen that way. We've already had 32 older adults access University Without Walls 462 times last year. Caring Calls is a newer program. It's a program that we really built out during the height of the pandemic, when with programs like Friendly Visiting, volunteers couldn't go into the homes of older adults. Caring Calls was a way to be able to connect in a safe way, really thinking about the health of others. And many have decided that this is the way that they prefer to have some form of connection with another volunteer. So it's a program that we've continued on. These as well are weekly phone calls that usually happen for about 8 weeks. So it's a shorter time frame than the other program I talked about before. And it's usually about a 30-minute call. But similarly, just with the goal of having a social conversation, seeing what movies they saw, sharing what movies you've seen, anything you've seen on TV, music you've listened to, really connecting over shared interests. And so we had 28 older adults last year who were interested, and they participated in a total of 655 calls, which is a really high number of phone conversations. So while throughout all of this, we've been giving a little bit of data around Community Board 8 participation already within specific programs, we wanted to even get more specific. So within Community Board 8, we had a total of 997 individuals who have participated in at least one program over the last fiscal year. And this number includes not only older adults, as you can see, which is a little over 500, but also an almost equal number of volunteers. What I will add in terms of volunteers, while we define an older adult as 60 and above, many of our volunteers are also 60 and above. And so for some individuals, the way in which they start to get connected with Durot is by volunteering. And then over time, they might make a decision where they decide it's time where a volunteer comes and visits them. And then we have just in total kind of a full breakup of the different percentages of different zip codes in terms of where these 997 individuals all came from. And I think with that, this is our last slide with just our contact information. I'm certainly going to be staying on for some questions, but this is the best phone number for giving us a call to be able to learn more, as well as also our general email address, which is info@durotusa.org. And we have a newsletter as well that goes out every single week that will share out a variety of different opportunities that we have coming up for either the following week or 2 weeks away, just so that you're able to also receive via email something directly in your inbox that tells you what we're going to be doing in the next several weeks.
Thank you, Julia. That's good. I'm just going to say that I know somebody that is very much an older adult that's actually the volunteer
Yes.
for another woman that has some mobility issues, who is an art historian, and she just said how much she's learned and what a wonderful relationship it is. So
That's wonderful. Thank you for sharing that. One of our more recent stories, she's a very unique volunteer, but it's still a lovely story to share, is our last package delivery that we did back in September. We had a volunteer who was 103. And she came to the office to volunteer to get a package to bring it to another older adult. I think who was easily 30 years younger. And she, at 103, is still a volunteer and very much sees herself as a volunteer versus a participant
maybe that she's going to stay younger.
Weird. The number of older adults that I have learned about in my time at Durot who are late 90s, even into their hundreds, is such a special story to hear about.
I'm going to ask two questions. One is, you listened to what was said before about the master plan. How do you fit into that? That would be the money that you would probably get. You would be part of that master plan, one of the pillars, do you think?
Sure. So I'll answer the question slightly differently and then get to the next piece. But our CEO, as well as our Chief Program Officer, actually were involved in some conversations around during the development of the master plan on aging. And we also worked to help facilitate a town hall on a day that was torrential downpour of rain, but to be able to bring individuals together to be able to speak to some state representatives about the master plan on aging. So it is something that we really feel is important and are really grateful to have in place, and are excited to see ways it can expand as well as also implement new. We strongly advocate about the need for social connection, regardless of how somebody is able to access it. So we will certainly continue that conversation and the best that we can do in a local sense or even a state sense to help build out more of those social connection programs. We're certainly happy to be one of the go-to through the plan.
Right. And the second question is, one of the main things I hear from people is, I need somebody to take me home from a test, from the hospital, from whatever. That's a service you have?
So this was a program that we used to have. And then during the with COVID, it became a program that really was not something we were able to continue to offer for health and safety concerns. Um, and then during that time, there was a review in terms of staffing and capacity and expense for the program. And so a decision was made several years ago to close what we called at that time our door-to-door program. It is absolutely still a need. We get calls about it all the time, and we completely understand the need. Occasionally, we're able to have beginnings of conversations around if this was something that we looked to do again, what might it be able to look like? We're very thankful that we have some other partner organizations that do offer this, that we then just look to help connect somebody who's calling us with that need. But it is absolutely a need and a challenge.
Yeah, people have.
Absolutely.
Any other questions? John, can you help? Do you see any hands? John, are you on?
I don't see anyone with hands up currently. If anybody, no one has any hands up right now.
I was very thorough.
Yes, I'm going to ask one other question.
Please.
So one of the things we can do, I know that people look to volunteer, there's time to volunteer as well as to be of service. So that's one thing we will do. I'll make sure in my minutes and possibly John on our website, we will give some information about it. I think that's something we would know. Thank you, Julia.
Thank you so much. And I'm certainly happy after the fact, John, to send you, we have a summary flyer of that sort of puts everything
This
all
is
into
very
one
good.
place.
If you would do that, if you would send it to John, that would be great.
Absolutely. We're happy to share that with you.
Thank you.
Thank you so much. I really appreciate the opportunity to come and speak with all of you, and I hope you enjoy the rest of your meeting.
And you too. Well, I think that the coming through, I'd just like to take 1 second and talk a little bit about what I think we're going to be doing next. This committee worked very hard to get something I'm going to generally call shelter. It's not the right word, on 91st Street, and finally it's now called a welcome center. The Housing Solutions Agency is there, and this committee will be kept up to date. And part of the community board, I know Valerie asked that uh, we would give some information about what is happening. At this point, I did get a tour of the place inside. It is an amazingly nice looking place. I will find out soon whether they've actually started housing people there yet, but that is something in the future that we will talk about and look at it. Any other questions? Stain your face. Is there anything you want to talk about or um, and Elizabeth, I hope we get some movement on the taxis. We call for an adjournment. That's good. Thank you. John.
Thank you.
Okay. Okay. Bye-bye. And John, that's good. Thank you. You'll send me the text. Thank you, Elizabeth.
Yes,
Great.
I'm just making sure everything's ended on my end.
If not, I'll do it. Thank you.